Good morning, everybody. I'm very excited today to welcome back Dr. John Roberts. You can tell that we're authentic because my phone has just gone, don't know what it's doing. Dr. John Roberts, he is our ambassador, dentistry ambassador, and also, I think he's contributed recently with a fantastic article in our newsletter. And John is very much about a holistic approach to dentistry, and dentistry not just as a profession, but as a healing therapy. So we're going to have some great conversations today. And Flynn Jones is also with us. Flynn is a third year dentistry student at Manchester University. And it's going to be great to have his insights into where this practice needs to move forward and really become part of the whole healing that we're searching for. So I'm going to hand over to John to do a proper introduction and enjoy, folks. This is going to be great.
Thank you very much, Lisa. So excited to be here today and to emphasize where I come from. Dentistry always has been for me a healing modality. I have lectured in the past to dentists where the title of the lecture is "Never in the field of medicine have so few done so much harm to so many." And it came off the back of putting mercury fillings in now. We're not going to talk about that today, about not taking the seriousness of gum disease, which we now know is contributory to heart disease, Alzheimer's, preterm low birth weight babies. This is all in the science. We're now very interested in breathing, sleeping, snoring. And again, maybe there's a better debate about should we take teeth out for braces? Should we make the jaws bigger for braces? And Flynn might touch on his personal experience for that. That's one of the reasons why we met. But dentistry is also should embrace some more of the healing modalities. I'm at work today in the practice in Edinburgh. That's not an advert because I'm only here very limited. But we have lasers for healing. We have lasers for cutting. Lasers are a fantastic, versatile tool. More dentists should use it. There is a price tag with them. We're having a lady in today who I'm setting up ozonated water to clean and sterilize wounds afterwards. Ozone should be accessible to everyone. It shouldn't be charged as a premium. It should be accessible. It's so easy to do. So I brought my ozone machine in. This person chooses not to have antibiotics, which the gold standard would be you give them. But if they didn't want it, we are giving them choices. We can use homeopathics. We can use, your colloidal silvers, your other medicines. That's part of dentistry, but it filters into the wider world of working with homeopaths, working with energy medicine, working with all the skills that hopefully PHA is going to bring together. If we hone down in today, I have had lasers for over 20 years, as is the practice here. So if someone has gum disease, we can not only do the regular dentistry, but we can use the laser to clean. It has some fantastic abilities, but that red light, the laser light, stimulates healing that you can't do any other way. And it is stunning. Now, I first met Flynn a couple of years ago. I've always wanted to mentor young people, and through the PHA, that's what we want to do going forward. So allow that my time is somewhat limited, but if people want to learn more, we are producing a medium where we can teach dentists, dental students more about the dentistry, but also all the other people that come under the umbrella of PHA, your homeopath, your energy medicine, your osteopath, chiropractor, all of those. I'm only part of a team. We talk about the dental team. I'm part of a healing team, but we all have our little expertise. Flynn has his own personal story. Dentistry has maybe helped him. Dentistry has maybe harmed him, and he can touch on that. But because of he's driven so much to want to do well, and that's what we love, is a young man, and we actually went to the same school, but not at the same time. I love the fact I've got a young person who wants to go into dentistry, not to stick white fillings on your teeth and charge you a lot of money. Sorry, that's the way dentistry is going, and dentistry is a business. We all have to make money. But he wants to go into dentistry to help heal people because of his own healing journey. And you know what? He'll be looked after well enough. And the fact he's gone and invented and devised things, oh my goodness. So we're both from the Wirral. Flynn, the floor is yours. Your story first, where it's evolved to, and what have you created? And I'll butt in and just be annoying.
That's great, John. Thank you. So my name's Flynn. I'm a dental student, but I've come on here today to talk about, a wide range of things. My journey kind of started when I was 18. I'm 22 years old now, and I was diagnosed with an autoimmune condition called Behçet's, which basically is quite a nasty autoimmune condition where your body attacks your own blood vessels. So really nasty mouth ulcers, joint pain, fatigue. I probably had symptoms before when I was younger, but it kind of only really manifested when I was 18 through, a few factors that happened back then that we can discuss later. But basically it triggered this autoimmune disease and I was really, really ill. I'd gone from, rowing at, national level to hardly being able to get up the stairs. So I was stuck with these nasty mouth ulcers. I'd had my offer to do dentistry at uni and I deferred it. So I had a gap year and I was like really ill. I was like, right, come on, I need to get myself sorted here. And I was going to the doctors, they were giving me immunosuppressants, biological agents, steroids, and, nothing seemed to be working. I was picking up illnesses all the time. And I was like, there's something else going on. Lucky at the time, I was working as a dental nurse at an orthodontic practice to get some experience before I went on to do dentistry. And one of the orthodontists there, Dr. Richard Gibson, had kind of had a previous experience himself. And he'd gone through this journey and was absolutely in remission now and doing great. He was the picture of health. And he was a massive inspiration for me and kind of has taught me quite a lot. I think where I started, researching all the diet and the food and, how it goes. You start one thing and you go down this massive rabbit hole. I started cutting out gluten, dairy, and I realized that certain things were triggering me, certain things were giving me more ulcers, fatigue, and I improved my diet. I was always healthy, but there's things you don't realize, like seed oils, gluten, that is a whole bigger picture than just your standard healthy diet. So I started seeing improvements, and they were slow, but started seeing improvements. Started being able to taper down on the medication, and I got to a point where I was doing well, but I was still getting these really nasty mouth ulcers. And Rich was like to me, there's a missing component here. It's light. We're not meant to be living inside all day, every day. We're supposed to be outside 95% of the time. So Rich had been using light therapy in his orthodontic practice, and he works at a hospital as well, using light to heal. And initially he came across it as there was a study where they used red light therapy, so it's also called photobiomodulation, to extract a tooth, and they'd used really, really powerful red light therapy instead of local anesthetic. And the red light therapy was that strong, it completely numbed the whole mouth enough to extract the tooth. So Rich saw this and was like, right, there's something here. So I won't go down that story, but this is how he got into it.
That's one for another time.
That's one for another time. So
that's a live demonstration.
Yeah.
Volunteering to have a tooth out.
Give it a go on you, John, later.
Yeah.
So Rich and I came up with this prototype and started using red light therapy in my mouth on my mouth ulcers. And you know what? Sort of dramatic improvement, absolutely dramatic improvement. But I'll talk about that later. But this is what made me realize that actually you can do all the food and diet stuff and it can really get you to a better point and improve you. But, healing is a whole picture, sound, light, it's a massive modality. And, when a lot of people are doing all the diet things, but then they're also, staying up till midnight every night and not getting outside. So it's really interesting. It dates back to the dawn of time where we've used sunlight to heal, they used in the late 19th century, early 20th century in the Swiss Alps. They got hospital beds outside for people to lie on to use the cold air and the sunlight in the high latitude and up on the mountain to heal TB. It's been used forever, and like John said, where now, capturing the sunlight and seeing what parts of sunlight are allowing us to heal and using it in dentistry. And I think that's just amazing.
And
Absolutely.
as we speak, there are dentists using lasers to cut because they're that good and to heal. And that's the total power if we start to embrace what lasers can do. If we then add on, and this is again for another time, what Flynn's saying about full spectrum light, and you have to remember that X-rays are brilliant if used appropriately, and it's all the same electromagnetic frequencies. We also have the harm of Wi-Fi and 5G and all the stuff that's spinning around. That is harmful. So we have to embrace what's good.
Absolutely.
And it's appropriate, but also harness the power. So this is this red light, which is just, once you've used it, it's stunning. I think, Flynn, you continue with your story about your exploration into red lights and red light healing.
For sure. So if you go outside and you get a spectrometer and you point it at the sun, you look at the light frequencies outside, you'll see there's UVA, there's UV. This is if you checking at certain times of day. The light frequencies change throughout the day. So in sunrise, there's more red light in the atmosphere, and then at sunset also more red light, and then in the day, in the midday, there's more UV. So we've got UVA, which is great for when it hits your skin, releasing nitric oxide, which again links to dentistry, because what happens when we nasal breathe, it increases your nitric oxide, lowers your blood pressure. You've got UVB, which when it hits your skin, which we'll talk about, UVB, it converts cholesterol into vitamin D, which is so important. A massive, it's a steroid hormone that controls all the, different biochemical reactions in your body. We've got red light, we've got visible light, and we've got infrared as well. And infrared is that, longer wavelength of light, towards 700 to 1400 nanometers, which penetrates really, really deep into your body and can stimulate these healing modalities. So, light therapy is really becoming quite popular. You see a lot of, beauticians, practitioners using red light for, cosmetic reasons, for healing injuries, and physios, chiropractors, and dentistry. So it's becoming really popular, but also there's that UV side of things as well, which is also becoming popular. People are now using UV to improve their vitamin D. People have got UV lights, and then there's all that thing about as well, like SAD, seasonal affective disorder as well. A lot of people, especially my age, suffer with it because we're inside all day. So, we're looking at these devices, these lasers in dentistry, but we've got to remember the fundamentals of it is coming from nature, and also a lot of time when we go back to nature, that's when we heal. So, red light is really, really powerful. It basically works on cells called the mitochondria. So when it gets absorbed on your skin, it's absorbed by cytochrome C oxidase, and that's a fancy term, but basically it's a little protein, the mitochondria, that absorbs the red light. And what it does is you have the electron transport chain, which basically, in simple words, how the mitochondria work and how they make energy and how your body generates energy. And all the red light does is it gets absorbed by the mitochondria. It stimulates your mitochondria to make more ATP, more energy, and this is what generates the healing. So this is the fundamentals of the. It's really interesting.
It's amazing.
The nice thing is we've gone through observational medicine, putting someone out, on a bed in the high Alps, using sunlight, using different temperatures. We observed it work, but we didn't know why it worked. And if you fast forward to today, and if you're interested, there is so much research out there, and the laser groups within dentistry, the laser groups within healing, but it's not my lasers are better, or even it's laser treatment. It's laser plus. And this is why we're so excited. This is one facet, and this is really where science now meets observation. And it's like, why aren't we doing this? Because the science, now we can look at how the mitochondria work, how the cytochromes and the electron transport chain work. And I can talk about this with my homeopathics. But science is catching up, and we can't hold on to what doctors tell, because if they don't know the science, and this is only science,
Mhm.
then it gets so exciting. So let's embrace the science, which is really natural.
Mhm.
Carry on, Flynn.
For sure. So I'll just talk a little bit about UV before we deep dive into the lasers. So, we all know vitamin D is really important, but we don't understand that getting UVB from the sun and generating that vitamin D can have a different effect from taking it orally. What happens is when you get that UVB from the sun, it hits your skin and it converts cholesterol, 7-dehydrocholesterol, into pre-vitamin D. So basically it goes from the sun to your skin, converts that cholesterol into pre-vitamin D, which then turns into vitamin D. And that sulfation of the cholesterol, so converting the cholesterol into vitamin D through your skin, is a complete different mechanism to when you take it orally. When you take vitamin D orally, it converts it through the hepatic system, through the liver, and through the gut. Now, when you get that signal from you, it comes from your eyes onto your skin from the UV, it converts that cholesterol into vitamin D, and it tells the body where that vitamin D should go. It also is controlling your cholesterol as well, because it's converting that cholesterol into vitamin D. It's using that cholesterol. People demonize cholesterol, and a lot of doctors just put you on statins, but actually cholesterol is the fundamental of so many hormones. And go on, John. Yeah.
You've got to question why.
Yeah.
My cholesterol done. And the doctor says, I said, I'm not even going to go with that conversation. It was 5.8. It's always been 5.8. I've been measuring my cholesterol for over 25 years. That's what my body works. If I drop dead tomorrow, but I drop dead happy. And we're not going to dish the medications. We're going to say it's my choice. It's my choice as to whether I choose. And I eat butters because butter's good for you. And we can look at the skin cancers and we don't treat cancers, but you heal from the inside out. If you take good oils from the inside, it percolates out, and this is Scottish rust, by the way. It isn't, going abroad or anything, but I'm out in the sun whenever I can.
Yeah,
absolutely. Me too.
You don't realize as well that the melanin that you make from the sunlight is a natural protection to your body. 99% of the UV gets absorbed by melanin and dissipates the UV into harmless heat. It protects you from reactive oxygen species. And melanin is one of the biggest antioxidants the body can have. It protects you from EMF. It's a semiconductor. That's why as well, sometimes you'll go on a long plane journey, across the Atlantic, and your tan fades very, very quickly, and you wonder how have my tan disappeared after 24 hours.
By the time you get home, it's gone.
It's because the melanin is absorbing the non-native EMF that you're exposed to from the plane and protecting you and your body, which is really, really fascinating. So there's so much that we don't know and haven't researched.
And the big thing is,
can I just say, there's a lot that we do know that has been deliberately hidden from people. Why block the sun? Why wear sunglasses? Why put creams on that contain heavy metals? It's we know, don't we? But again, that's another discussion. But
back to that sun cream thing, and sunglasses, it's really interesting. I'm sure Lisa, but wearing sunglasses gives you a mismatch of signal because your eyes are supposed to absorb that UV and tell your body, it's daytime. Let's make melanin and protect our skin from the UV. But then if you're wearing sunglasses, it's blocking that signal, so you're not creating the melanin, not protecting your body from the sun. And again, with sun cream, it's changing that natural spectrum. You're blocking out that UV, you're blocking out that UVB, which is making the vitamin D, and you're shifting that spectrum. And also we know now that it's not just the UV that can cause damage in isolation in vitro, not from the sun, but also blue light is massive. And also, using at night, that's a non-native EMF that's causing people, sleep problems, it's causing damage. It's a massive problem.
Isn't it wonderful, John, to hear a young person talking about this?
I'm humble that there's a big age difference between us, and it's like, I wish I'd have known all of that. The other interesting thing is we shouldn't do what we now do, is to go and sit in the sun for 2 weeks and then don't sit in the sun. It's important, even in winter, although there's not a lot of these wavelengths there, to always have our sun exposed, because when we start to see the sun around Easter time, or Friday, Saturday, Sunday in Scotland, you start to expose your skin come Easter time, generic.
Yeah.
And then you build up the melanin. So when we get the hot weather like we've just had, we've already built up that immunity with our skin to the harsher rays. So it isn't go and get UV and look at the suntan I've got. This is every day. And you listen to some of my things. I will do something in the garden, because the more I can sit in the sunlight from low and crescendoing up to high, and then back down again, that's given me a year protection rather than 2 weeks, blocking it all out.
You're also getting out in nature, and for your mental health, I mean, the benefits, are huge.
So carry on, Flynn.
John, I think that's a really good point as well. Building up that solar callus. We know that if you don't go outside at all, and then you go on a 2-week holiday to Turkey and you burn, obviously that's not good for you. But if you're building up that solar callus almost, and building up that melanin throughout the year, it's going to protect you.
Good. He's so good.
And another important research that's come out as well is that actually using red light therapy, which mimics what the red light you're going to get from the sunrise, and actually seeing sunrise gets your skin prepared for the UV in the day and starts your body its natural protection mechanisms. But we can also get a bit of that benefit from using a red light panel as well, or red light or lasers in the morning. So if you know you're going to have a high UV exposed day, if you get a little bit of red light on your skin in the morning, that's going to help your body start protecting itself for that day as well.
And I think the important thing is get to know how your body works.
Yeah.
It isn't a justification for, and we're only saying that for medical legal purposes, folks. Carry on, Flynn. It's all good. It's brilliant. In fact, it's brilliant. I'm I'm just loving this.
So anyway, quickly back to the story. So I met John probably about 3-4 years ago now. So Dr. Gibson and I, who I met at the orthodontic practice, we'd kind of found that this red light was really working in the mouth amazingly to reduce inflammation, reduce the pain in my mouth ulcers, and we're like, this is brilliant. We need to do something with this. So we found this prototype of a red light toothbrush, and then we got in touch with the team who'd made this prototype, and we kind of came together and formed this company called Bristle, who is using red light therapy in a toothbrush. I'll talk about this later, but basically using red light therapy in a toothbrush to reduce that inflammation just whilst you're brushing your teeth, 2 minutes twice a day. So Rich and I were using this, and found a massive reduction in pain. And I was right. We need to get this out there. I need to see more practitioners, who are using lasers, and talk to them about this. So I started researching functional dental practitioners, in the UK, and that's where I came across John. And then we met up and realized, we had a lot in common. And John has.
You went to the same school.
Yeah, what a coincidence.
It's a great intro. We went to the same school. Yeah.
Because John was over in Huddersfield at the time, and I was over in Wirral. So it's completely a long way away. I didn't expect him to go to the same school. So no, but John taught me a plethora of knowledge. But yeah, fate for sure. A plethora of knowledge, and we can talk about teeth removing, extractions, and all this, and airway and breathing. But dentistry is such a massive topic, and it's just so fascinating. There's so much more to dentistry than just drilling teeth. But yeah, so go on, John.
Can I just jump in and take a step back?
For sure, go on.
That we should do as dentists, we've talked about the importance of light on and creating our own vitamin D. Vitamin D is so essential for so much, and it's not a vitamin, it's a hormone. It just got called a vitamin because we found vitamin A, vitamin D, vitamin C. We called it vitamin D and whatever. We haven't talked about vitamin S, which is sunlight, which is so important. But as a dentist now, vitamin D, with its effect on decay in teeth. Now, there's more research, but if you go back to Western Price, which I'm sure a lot of the listeners will love, vitamin D was that substance that's I can't say stops dental decay, but they're looking at, is that the reason why? Sorry, it's me, officer. But when we do surgery and putting implants in, doesn't matter where, we will now want to do a vitamin D test. And if your vitamin D isn't above the 50 micrograms that you need, then you're not going to heal as well.
Yeah.
So have a vitamin D test and get your D levels up, either by doing your sunlight therapy, or unfortunately, if you want to do it quick and you can't get out in the sun, start to take vitamin D, and we can talk about different types of vitamin D, but you need that level so you're going to heal better. Why wouldn't you use vitamin D to make sure your body's going to heal better? So all I want to say is, if you're going to have any surgery in the mouth throughout the body, make sure your vitamin D levels are right. The way you do that is long-term sun exposure appropriately and correctly, as Flynn's pointed out. Short-term, you can supplement up. And I'm not going to talk about decay today, but vitamin D for kids and decay. And every parent, I know, I don't really give it. You need to test. And if you do a pinprick, 15 minutes later, you can get your vitamin D level. That's your baseline. That's where you're starting from. I know mine's 60, and I can live with 60. Back to you, Flynn. Sorry.
No, that's really interesting, John, as well, because we know, vitamin D, it's a steroid hormone. It's going to reduce the inflammation in your gums. So, if you're having any periodontal treatment, any surgery on your teeth, if you're reducing that inflammation first, getting your vitamin D high, it's going to help you recover quicker, especially if you combine it with things like, light therapy and, like you said, John, ozone as well. There's loads of interesting things. I think it's difficult as well. We're circadian beings. We're supposed to live with the seasons. We're supposed to be cold in winter and be, exposed to that UV in summer. I think people as well, harp on about, diet massively, but we don't realize, going back to hunter-gatherer times, in winter, there wouldn't be many carbs available because there isn't much UV. So the UV isn't hitting the plants. So it's not growing fruit because UV is required to grow these tropical fruits. If you think pineapples only grow, like near the equator. In winter, what would be available? It would be more meat. It would be more fish, very little carbs available. So in winter, we would be a bit more keto, maybe fat adapted, because there'd be more fat oxidation happening because we wouldn't have those carbs available. And then we shift over to summer and there's more fruits available. So where our bodies naturally adapt to be able to digest those foods, because you're getting that UV signal to be able to digest the carbohydrates. And we're shifting from that keto to more, a carb mix based diet. People think, let's go carnivore all year round, let's go keto all year round. But, that's not what we would do ancestral wise. Is really interesting. You've got to look at food as almost like a barcode, like an electronic barcode, because the food that grows is made from the sun, UV, and it has this electronic barcode, and you eat that and it tells your body what to do with those electrons. If you're in winter and you're eating a pineapple, maybe that's going to cause inflammation. If you're in summer and you're living in tropics and you're eating a pineapple, that's going to be really beneficial for you. So it's interesting. And quickly, why I started this was because going back to the vitamin D, what happens is in the summer, you have more carbohydrates. So you put on a bit of weight, a bit of fat. So the UV gets stored in that adipose tissue in the fat. And then you go into winter, the carbohydrates aren't available. So you burn that fat and release that vitamin D into your system, so it's a whole picture. You can't just look at it as, we need this vitamin D, we need this. You've got to look at it as if what would have happened, hundreds of years ago.
And there's a reason for seasonal fruits, isn't it?
Yeah.
So if you can follow the seasons.
But we will have avocados all year round because they're healthy. We can have spinach all year round. I choose not to eat spinach because the oxalates are too high.
Yeah.
Remember, plants weren't developed for us to eat them. If you eat plants too much, wheat, dairy, spinach, broccoli, they're all toxic, but they're a little bit toxic that makes our system detoxify. That's why we say they're health foods. But really, again, not wanting to upset people, but the science seems to be going there. Animals condense those toxins and get rid of them and condense the nutrition. So when we eat the meat, it is a more nutrient dense way of doing. I don't want to upset vegetarians, and fine, but realize that
My daughter's
smoothie.
favorite phrase, nutrient dense.
Yeah,
Yeah.
a spinach smoothie has a lot of things that aren't good for you.
Yeah.
And that's where science is showing us now. So I'm not being science, because I love my energy medicine more than most. But science is catching up with what we've observed. Carry on, Flynn. Let's talk about red lights.
For sure. So red light therapy. So, we're using this toothbrush and we're seeing massive reduction in inflammation and, other biomarkers as well. We've had patients using the toothbrush and the bleeding's completely resolved, and then they've gone on holiday and forgot the toothbrush and the bleeding's come back, so we've got so many, reviews and people using the toothbrush and really liking it. So, we know it works. And if you go into PubMed and type in red light therapy, there's a plethora of information there. And John, like, for instance, do you want to talk a little bit about what lasers you're using in dentistry before I go on to the light?
Well, we have lasers a different wavelength. And as I say, there's the water laser, and there's a couple of lasers. The water laser we like is a cutting laser. So when I used to do tongue tie surgery, we would just have the water laser and it would vaporize, which would also mean cutting with a laser means there's no scarring, because you literally vaporize the tissues. So there's a lot less scarring, which we get to energy medicine. You don't want scarring. You can then dial it down, and you can use the laser down between the gum and the tooth. And it just basically, the laser hits the water molecule explodes. So you get this like tsunami, and that's super cleans around the tooth, rather than the dentist getting that thing and scraping clean.
Yeah.
Because it's not just the surface of the tooth, it's the gum that's facing the tooth. So you go in, go between, the red light is healing this and cleaning off all the infection here. It's hitting the tooth and cleaning off all the gunk that's there. And the nice thing about, and we're learning more about lasers and why we're using ozone, is that bacteria live in the tooth. They're not living here. They live in the tissue and get into the body. They live in the tooth. And so if you go and give it a good clean, they just move into the tooth. And then when you're not keeping it clean, they move out of the tooth again. And there's some studies in the 90s that did all of this. So why does a root canal cause a problem? Because bacteria live in the root. And why do healthy people not have bacteria living in the tooth? I'm trying to put this story together. If you have good vitamin D, fluid flows up through the tooth, through the tubes and out, and that's self-flushing. Think of a tree. You've got this constant fluid flow, and that's what Weston Price saw. I think he called it substance P because he didn't know what it was. Then we discovered vitamin D. It's not just quite that story, but vitamin D is flushing it. But where were the people not having decay? Was the people eating lots of fish, lots of cholesterol, living outside in the sun all day. And now we live inside. We don't get the fats. We don't get the vitamin D produced on our skin. And we're seeing more decay because we've reversed that fluid flow. But that's nutrition helping dentistry. But we can just fill that hole.
Yeah.
Why do we get that hole? So your lasers will clean and sterilize into a tooth. But really the best way, you've cleaned it all. Why not then change the internal chemistry of the person? Because dentistry is an outward manifestation of an illness. So, but we can be very clever and have the lasers stimulate healing, clean out the bugs, kill the bugs, and then, like we're going to do today, send someone home with some ozonated water in a glass bottle. It'll last for a couple of hours, but then get a red light that they can put over this area and also stimulate the lymphatics, so the lymph nodes where everything drains to. If you keep them open, it flushes. And the big thing with a lot of illnesses, we have clogged lymphatics. So you naturally pour in all your healing modalities. Unless it can flush out, it just gets bigger and bigger and bigger. So drainage and draining of these toxins is as important as putting the healing there, because you've got it all. You've got a roadblock. Nothing goes anywhere. And then the bugs move in because, wow, we've got all this stodgy stuff that no one's draining. Draining the lymphatics, which is what you can do with lasers. And, we will do this. We'll do down here, even axillary lymph nodes. What we've now got is and I'm not saying you get a toothbrush and start doing this, but maybe you can enlighten us on what you've developed, Flynn. And we're not here to sell this. We're just saying
Absolutely, it's fascinating.
red light heals everything. You know, it's like, oh, I'm not wearing red. This is as a bet for the Liverpool player who's just passed. But the bottom line is these are healing modalities, and you can use it on any part of your body, your knee, your foot, your ankle, your spot, whatever.
Absolutely. And you know, it's great because you're really connecting the dots up here, aren't you? We're talking about nutrition.
Well, the thing is, we have you know, 100,000 dots to connect up. We can already see the picture. People want to do one dot at a time. So I don't see the picture yet. Can't see the picture yet. We've stepped back, and the dots tell us the story, which is healing. Carry on, Flynn.
Yeah, I think, John, the thing you're talking about is really interesting. So, you know, we know that in the tooth, we've got that dentine and these little tubules called dentine tubules. And like John was saying, when we're in an inflammatory state, you know, that saliva is going to flow in. And when we're in a non-anti-inflammatory state, you know, it flows out and flushes and cleans the teeth. And we know red light is a vasodilator, which means the blood vessels dilate, which increases blood flow, which is going to help the lymphatic system. It's going to, you know, clear out all the inflammation. You know, there's so much to it. You know, in the toothbrush we also use, as well as red light, we use 410 nanometer like near UV light, which is really, really interesting because what it can actually do is there's little bugs called P. gingivalis, which is what causes gingivitis, which is basically gum disease. And this 410 nanometer light, when you shine it around the mouth, it snaps the tails off these P. gingivalis bacteria, which renders them immobile. So, you know, they're not moving around the mouth and not causing the gum disease and the inflammation. So, you know, you're cleaning through the near UV, you're, you know, improving the microbiome because it's targeting that P. gingivalis, but it's not wiping out all of the microbes. It's targeting some of that more bad microbes that's causing the inflammation. Then it's also having a little bit of a lightning effect. We wouldn't necessarily call it whitening, but like a lightning effect, because you're going to get a reflection of that near UV light back from the teeth, like a biophotonic reflection. So your teeth are going to look a little bit brighter, a little bit lighter. It's going to clear out that stains in the dentine tubules. Sometimes there's like debris in these dentine tubules, and what that near UV light does is it breaks down that debris and removes stains. You know, it's really, really interesting. So you're improving your oral health, you're improving the aesthetics, and then you've got the 635 red light, which is reducing the inflammation, working on the mitochondria, improving the overall redox state of the mouth. You know, it's really, really fascinating.
It really is.
Would you say that, I mean, there's a couple of things there. No one sterilizes a toothbrush. Yeah, we clean off all the bugs, and then we put it next to the toilet. So every time we flush, we're flushing. I'll leave that to your imagination. So having a toothbrush or a way. So I like, and again, I'm going to mention a product name. There are lots of others, but there's a product called dental sidin that actually breaks the biofilm which in bacteria live. And, you know, I'd love to do a short snippet on showing what it's like to take bacteria out of the mouth and look at it under a light microscope. It's stunning.
Oh, yeah.
But by sterilizing your toothbrush, you're not reinfecting yourself all the time. And you're actually using something that not necessarily kills the bugs, and the UV light and the vibration is what snaps the tails off the bugs. So they're bobbing around rather than swimming around. But then you have, every time you're breaking up the houses, the biofilm, which is where the bacteria live. And that's what lasers do. They break up the biofilm, and you're giving the body the energy to heal.
Yeah.
So it's just so exciting. And all it is applied science. Flynn, carry on.
Yeah, you know, it's really interesting as well. Like you just said as well, with flushing out the bugs. You know, saliva is a massive component of reducing, you know, dental decay, because it's flushing that bacteria. And people with xerostomia, which is just like basically dry mouth, you know, have an increased risk of decay because there isn't that saliva flushing out the mouth. And, you know, for instance, like there's the 4 laser, there's also other red light devices that stimulate the salivary glands to improve that saliva flow to, you know, flush out and reduce the decay as well. It's really interesting.
I think if you look up Thor laser, THOR, there's massive resources on the website. It's something that NASA use, and there are whole beds you lie on with lasers. It's stunning. Carry on, Flynn.
Yeah, and that's a good point, John. Red light therapy, a lot of the main research started by NASA. You know, they were in spaceships, they were trying to improve healing of cuts by astronauts, they were improving plant growth, and they started using red light therapy and saw massive improvements. So this is kind of where it's gone into mainstream.
Yeah.
Yeah.
So we can see this on your website, can't we, Flynn?
Yeah, so I think John was talking about a different company called
Okay.
THOR, but I've got so we run two companies as well. So I'll show you them now. So we've got the toothbrush as well, which is ultrasonic, and this is called Bristle, BRISTL, but we'll put the links in the description. So this is ultrasonic toothbrush. You can see the light effects there as well, and you can have it's a manual mode as well. 1, 2, hold it, and it'll tend to just red, or 1, 2 as well, and you can have that near UV light as well. So that's really interesting as well, because we found that actually it's more important to get the wavelengths of light right, and the actual power is important for certain things, but actually low dose power, like homeopathy, is almost just as effective, if not more effective, because it's just triggering those opsins in the mouth. And actually, you just need that wavelength of light. It's not necessarily the power to trigger that mitochondria to work. We've also come up with a mouth guard as well. This is more for people who have come from surgery, who have got really bad mouth ulcers. So this is the mouth guard here. What's actually quite neat about this as well is it's got UV light built into the case. So when you charge the mouth guard, UV light shines from the case into the mouthpiece and disinfects it.
That was a good sing, and I honestly did.
That's so clever.
I knew that. I forgot about it. So good one. Good one.
And then it's just the light here. So you've got the red, the dual mode as well, with the red and the blue light, and then just the blue as well. And it's really flexible, and it just goes into the case, and it has UV light to disinfect it. And we've had third-party EMF testers as well to test the EMF, make sure it's low. And we're just hoping it's a different modality for people to use at home. Who've got perio, who've got gum disease, who have got mouth ulcers to help improve that healing.
Would you use the mouthpiece without problems? Would it be better, or is the toothbrush enough?
For sure. So the red light wavelength on the toothbrush and the mouth guard are pretty identical. So you're going to get that healing red light from both. The toothbrush, obviously, you're using it for a shorter amount of time, for 2 minutes, but you can take the bristles out and use it as a light wand as well in specific areas, which is really interesting. Whereas the mouth guard is more of like a deep treatment. We recommend using it, 15 minutes, 3 times a week. And you're going to get a deep treatment. Of course, it's going to help people, who don't have any problems. It's going to be a preventative measure to reduce gum disease, reduce decay. The difference between the two products in terms of the blue light is the toothbrush is more near that UV range, so it's more antibacterial, whereas the mouth guard is more towards more of a blue light range. There's actually a whitening pen on our website as well, which you can combine with the mouth guard to get more of a whitening aesthetic as well, and that's obviously fluoride free, no harsh chemicals. We use a component chemical called PAP, which is completely peroxide free, and combines with the light to help reduce stains and improve whitening as well.
And what Flynn can't tell you, but I work with a couple of other dental friends or retired dentists. They'll take that mouth guard, and because it's got that red light, in theory, we haven't proved it yet, you can use it on other sore areas because you've got that red light wavelength.
Yeah.
So it's something simple and easy, and dare I say, you get stopped at an airport, you can just say it's a mouth guard.
Yeah.
It will have additional knock-on effects because you're carrying the right wavelength to heal and stimulate any other part of your body. That's something for the future, and it is only a theory at the moment, but it is a good theory, and science
It is.
catch up with us.
And it's very flexible, so you can.
Yeah, I think as well, John. You've both been taught a lot of anatomy. The floor of the nose is the roof of the mouth. So, you know, anything that's, you know, impacting the mouth is also improving the nose. And that's when you can go along with breathing and how expanding that upper jaw is going to improve your airway. Because if you think you expand that upper jaw, you're also improving that airway, you know, cavity. You're again more breathing through your nose, increasing that nitric oxide, reducing your blood pressure. You know, all this, it's interesting, but also, you know, using red light in the mouth and lasers in the mouth are also going to have effect on, you know, the floor of the nose, you know, almost maybe the brain as well, you know, improving that airflow, reducing inflammation in the nasal cavities, you know, for a lot of people with allergies and things as well. It's interesting.
And I think we're at that point where putting people out in Switzerland 100 years ago, we now know why it happened. We're now knowing what we're doing. It works in theory, and I'll be always specific because there's lots of new inventions coming out all the time. Certainly new designs of toothpaste that sound like a good idea, but I haven't seen the clinical trials to say they work. So we're talking about, we know what you're putting in the mouth is going to work. We know it penetrates, but we haven't yet done the science. Now, I'm not here waiting for science to catch up with what I know works. I use a lot of homeopathy. Homeopathy is now publishing why it works. And then science can't say it doesn't work because here's your scientific papers to say it does. It's such an exciting time. Meridians don't work. Yeah, you can put a light on it and show people meridians. You can inject in a meridian point, you can see chemicals. So we're at this interface where what was natural is now becoming scientific. And the science are going to have a hard time telling us science doesn't work. And all this, trust me, I'm a scientist. Way more trust me, I'm a scientist than the people who close their eyes and don't want to believe. And all I'm excited about is this is a third-year dental student who I'm just desperate to qualify. So he's got to stay within the rules and regulations. And it is calm down, calm down. There's plenty of time and places to develop your skills, but we need more young people or dentists who've just tried saying, wow, I can earn whatever thousands of pounds doing non-healing remedies, or I can have a more satisfied life and come and live in a more countrified area and help people heal, because that's much more rewarding than it is getting on the rat race and buying the house. And I'm not saying I've been there. Dentistry through health and healing has always paid my bills. And I think it's that quality of life, and not I'm doing dentistry to earn money. I'm doing dentistry to be part of a healing team.
I think quickly, just to go back to your point about the science, John. Yeah, you're right, and you know, the science is emerging, but you've got to also look at it, like in the NHS. You know, they're already using phototherapy in the NHS. They're using it for eczema. They're using it for, you know, born jaundice. You know, they're using it for psoriasis. You know, it is there. The science is there, and they're using it for specific cases. But I think what John and I want is we want it to be mainstream. We want it to be affordable. We want people to be able to use it and have a preventative effect, rather than, you know, coming 10 years down the line, you know, needing mouthful of fillings and, you know, perio treatment. So
we need to educate people and make these, as you say, mainstream, so that everybody knows about these.
What's your takeaway from all of this, Lisa, before we say goodbye?
Wow, I really want a toothbrush.
Okay.
My takeaway, it's what we talk about often, John. It's how everything fits together. But I think the real key for this, it's wonderful to have a young person who's receptive and actually not receptive, but is able to teach us as well. You know, as we look to the future and the future that we want. I think it's amazing to have this, and I think there's lots more discussions to come.
It's just the sheer excitement.
I'm so excited.
The old man who's been there, and he's, you know, a third of my age. Heaven knows what he's going to be like. His hair will be grayer, that I can guarantee. But the excitement that we've just created here, and whoever is listening, saying, but we're not here selling, because we can't please everyone. What we're wanting to do is sharing. You go to your dentist and say, please, can you think about this? And if the dentist is enlightened enough, they'll contact through PHA. Where can I learn more? Maybe I'll list myself to the PHA and I can see more of these kind of people, because they are these kind of people. But the rewards are unbelievable.
Absolutely. And we are growing our
Yeah.
directory and we're getting more dentists on there. So yeah, absolutely to your point, John, you know, if you're listening, you're in the dental profession, you're interested, get in touch with us. And people are crying out for this information, they really are. I mean, we get contacts all the time saying, what about this? What about this? And we need a holistic dentist. We've not got one in our area. So if we can get people on the directory, we can help signpost people to you.
That would be fantastic.
There's lots of people. We are going to provide a link in the description to the toothbrush and the mouthpiece, and also provide a discount, aren't we? I think, Flynn, for our listeners, if they're interested.
A generous discount. Can I also ask if we can put a link to the vitamin D test? Because
absolutely,
dentists, you know, you buy this, it's a couple of £100, but it'll cost you £30. But you know, if you measure it, you can then do something about it. Instead of, oh, my vitamin D is fine, I do it, they're 20. They're not going to heal. So there'll be a link to another company. You contact them, but if you test it, you can then do something about it. Plimsoll said that, I think, you know, the guy with the Plimsoll line on the boats, you know, measure it and then you can do something with it.
Absolutely. No, it's a great point. And actually, John, I think you've been looking at the BioKiss.
Yeah.
Amazing, isn't it?
Just with my history, why don't we test ourselves? And there is an evolution of, you don't know unless you test, and then you can put yourself on the map, and then you can create a direction you want to go. That's something that I'm developing a little bit at the moment. But yeah, my vitamin D is fine. Test it, it's 20. It's not good enough. So, but if you get your vitamin D right and you heal better, why wouldn't you do it?
Absolutely.
But
Definitely.
No,
Brilliant. You've both been amazing today. It's been wonderful. I think we've got lots more we can talk about in the future. I would invite anybody that is, is listening to this recording to get in touch if there's a specific topic you'd like us to deep dive into. But I think as we are getting more and more holistic dentists involved in PHA, I'd love to see a roundtable discussion develop at some point. So it's exciting times. We've got some wonderful stuff going on, and I look forward to the next one.
Amazing. Thank you, Lisa.
Yeah. Cheers. Thank you.
See you. Bye-bye.